Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide good general medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your primary care doctor to obtain medical advice that's specifically tailored to your needs. At the end of the medical information, I will provide some spiritual information. If you do not want to stay for that portion of the video, at the end of the medical information, I will let you know, and at that point, you can simply click away. And finally, do like and subscribe. Today, we're going to talk about resistant hypertension. I have 3 previous videos that spoke about different aspects of hypertension. Hypertension is elevated blood pressure on an ongoing basis or a chronic basis. Hypertension. We don't have a cure for this. The main treatment is lifestyle and lifestyle changes, or optimize your lifestyle, and certain medications. Okay, that all being said, today's topic is resistant hypertension. So we define that as a person who has been diagnosed with hypertension or chronically elevated blood pressure, who's on 3 medications, appropriate medications, at appropriate doses, and the blood pressure is still greater than 130/80. So resistant hypertension is defined by a patient who has a diagnosis of hypertension, which means that blood pressure has been elevated on an ongoing basis, and they're on 3 medications, certain types of medications. I'll summarize that in a moment. And they're appropriate, they are at the appropriate dose, yet the blood pressure is still consistently, persistently greater than 130/80. So we call that resistant hypertension. And we do have ways to help with that. And I do want to mention right now the 3 medication classes that we consider appropriate classes for treating hypertension. You can think of that as A for ACE, or A for ARB. And I went over that on a previous video. C, calcium channel blockers, and D, diuretics. And when we say diuretics, we're really speaking about specific diuretics, usually the hydrochlorothiazide or the chlorthalidone, the thiazide type of diuretics. And I do explain that in other videos. Okay, so let's say you're on those 3 medications and yet your blood pressure is consistently greater than 130/80. So that's resistant hypertension. So at that point, we check or consider a few things. First, we want to make sure that we are checking your blood pressure accurately. So we want to make sure that we're doing the blood pressure correctly in the office with correct blood pressure machines, with the correct positioning. And then we also want to make sure that we check your blood pressure at home. We have various ways to do that, and I did discuss this in the previous video. So let's just make sure that our record keeping is accurate and we're intentional in how we check the blood pressure. In other words, we're doing it accurately. Okay, so let's assume then it's accurate at 130/80 or higher. So another thing that we worry about is white coat syndrome. So it truly might be the case that your blood pressure is only elevated in the office setting. You can make a case that you need blood pressure outside of the office for that, but it's possible that you don't. So that, in other words, maybe we need to check your blood pressure more accurately in the office and at home. And then the reason your blood pressure could be elevated, it could be because you have what we call secondary causes of elevated blood pressure. So in my previous 3 videos, I was primarily discussing primary hypertension. Sometimes you'll hear a doctor call it essential hypertension or benign hypertension. So we have at least three names for the same thing. But you could think of it as primary, because now in this video, I'm going to let you know that sometimes there are secondary causes other than the primary cause, which we don't even know exactly how that works, but that's what we call it. But secondary causes, we do know what's going on. You could think of at least 10, maybe more secondary causes. They're not too common, but they're common enough that if you have resistant hypertension, you should get checked. And you might have to remind your doctor to please check X, Y, and Z. So kidney disease, I talked about chronic kidney disease in a previous video series, CKD. That could actually cause elevated blood pressure. Endocrine disease, for example, hyperthyroidism, where your thyroid is working too much, but even hypothyroidism can contribute to elevated blood pressure. Aortic coarctation, there are certain abnormalities of the structure of your cardiovascular system that could make you prone to have elevated blood pressure. Oral contraceptives, not the hormone replacement therapy. So if you've seen my previous videos, you know that I'm a senior care specialist. So usually I see patients 65 years of age or older, with just a couple of exceptions. So obviously I don't have that group of females on birth control pills. They would, if anything, be on HRT, hormone replacement therapy. And hormone replacement therapy does not raise blood pressure. But for the younger women listening, or if you have a family or friend with high blood pressure and they're in a younger group, birth control pills or oral contraceptives can contribute to elevated blood pressure. There's a few different reasons for this, but one of them we think is the estrogen component. So if you do have high blood pressure and you have to take a birth control pill, then you might want to ask your provider or physician to give you the lowest possible dose of the estrogen. Pregnancy, there are certain complications of pregnancy that raise blood pressure. Hyperparathyroidism. So in my practice, I see a lot of hyperparathyroidism because the kidneys, if they don't work right, say in chronic kidney disease, then they're also not going to be helpful in the part they play in bone metabolism. So that's going to throw off the bone metabolism portion of your endocrine system. So hyperparathyroidism means that your bone metabolism is not working well. You could have higher blood pressure. You could be at increased risk of fractures from falls. There are certain vascular disorders that can raise your blood pressure. There is a not very common, but it needs to be found condition called pheochromocytoma, and that has a long list of symptoms. And then obstructive sleep apnea. A lot of times we abbreviate that as just sleep apnea. There are a lot of factors that can give a clue to your doctor that they need to check you for that. But I really encourage all of my viewers to read. If you think that you're at risk for a condition, you really should bring that up to your provider or physician. Addison's disease, which is another endocrine disorder. Aldosteronism, you might hear this called other names like primary hyperaldosteronism, but that can definitely contribute to elevated blood pressure, and we do have specific lab tests to check for that. And obesity. So those are some secondary causes for elevated blood pressure, and those can be part of what's making your blood pressure resistant to treatment. It gets a lot more complicated than this. Maybe I'll do another video series on going deeper into the biochemistry. But I wanted to give you a list of secondary causes. Let me give you the list one more time with the ones that are the most common. Sleep apnea, hyperparathyroidism, aldosteronism, chronic kidney disease. Those are some of the common ones that you don't want to miss. Okay, and the last part of this video, I wanted to let you know that there are some new drug classes coming out to treat hypertension. And let me give you 3 medications that you can begin to keep an eye out for. The first one is aprocitentan. And that one affects a chemical called endothelin. That chemical is very powerful in raising our blood pressure. It's a dual endothelin receptor antagonist, so it blocks that mechanism. So look for that one. It's spelled aprocitentan, aprocitentan. Okay, and then there's another class of medication And the first one I wanted to name, you can think of it as STATs, S-T-A-T. I know that's a bad name because that's actually a medical term, but that's the syllable that this class ends with. Baxdrostat and lorundrostat. Okay, baxdrostat is spelled B-A-X-D-R-O-S-T-A-T. And lorundrostat is spelled L-O-R-U-N-D-R-O-S-T-A-T. Okay, so I'm going to go back a second. The aprocitentan, it is a dual endothelin receptor antagonist, and it was recently approved by the FDA. Baxdrostat and the lorundrostat, they are selective aldosterone synthase inhibitors. Inhibit, stop, go against. They've demonstrated effectiveness in clinical trials. So look for those 3 medications coming out. Okay, that's the end of the resistant hypertension recap. I just wanted to put that out there that sometimes there is resistance to treatment. We have new medications coming out on the market. Look for those. Look for secondary causes. And let's move on to the spiritual information. So you can click away if you do not want to hear the spiritual information part, but please first do like and subscribe. Okay, so for the spiritual information, my viewers will know that I am a devout Christian. I am not trying to proselytize or turn you into anything. It's just that through my almost 25 years of medical practice, I have found that patients who have a spiritual discipline, they have a religion, or even close family ties, something that is greater than their own personal story, they tend to do better. And the scientific literature bears that out to some degree. So I do encourage you to find a deeper meaning in your life. I am an author. I have written 2 books. I'm working on my 3rd book. The first book is primarily theological in nature. The second book is a work of fiction, completely a work of, in my mind, a work of art, complete imagination. It's just meant to entertain. And the third book is also going to be meant to entertain. But I wanted to show you my first book. So this is called You're Saved, A Spiritual Perspective from a Doctor and Military Spouse. Yes, I am a doctor and I am a military spouse. And that's my name, Laura Tigler, MD. So if you type in You're Saved and Laura Tigler on Amazon, then you'll find the 2 roses. And that'll be your way of knowing that you found the right book. Okay, but I encourage you to read it. I humbly submit that I believe it is excellently written and engaging, and you'll enjoy it. So I'm just going to read a prayer. I include a prayer at the end of almost every chapter. Let us pray. Dear God, thank you for allowing me to see visions of loveliness. Thank you for allowing me to hear your word, even when it came to me by reading a book, or in listening to words of advice from my mother, or in my mystical visions of you in heaven. Thank you for guiding me even when I did not realize I was being guided. Thank you for giving me the benefit of the doubt, even when I probably did not deserve it. Thank you for saving me. Amen. So, see you next time.